So now we are going to discuss chronic diffuse sclerosing osteomyelitis. So firstly, we discuss the focal sclerosing osteomyelitis, and now we are going to discuss chronic diffuse sclerosing osteomyelitis. It occurs at any age group, no sex predilection, male or female. The exact cause is unknown. Common in edentulous mandible, so it is not particularly associated with tooth, because it's affecting the edentulous mandible. There is no teeth or tooth. Insidious in nature, that means there is no clinical indication, sign and symptom of its presence. Acute exacerbation may cause vague pain. Sometimes the condition may undergo acute exacerbation, and this causes vague pain, unpleasant taste, mild suppuration. Mild suppuration could be present. Drainage through fistula tract. The suppuration, the pus formation could be drained through the fistula tract. The radiographical appearance of the chronic diffuse sclerotic osteomyelitis, as we can see here, it looks like cotton wool appearance. This is the cotton wool appearance with indistinct border. Why? Because it is diffuse in nature. So the border cannot be distinct because it is diffuse and usually affecting the edentulous area. So this is the edentulous area, and here we can see the cotton wool appearance and also the indistinct border due to diffuse in nature. There is another type called chronic osteomyelitis with proliferative periostatis, or what we call Garre's osteomyelitis. Focal cross thickening of the periosteum. There is periosteum, so there is thickening in the periosteum with peripheral reactive bone formation resulting from mild reaction or infection. So there is low-grade infection, and there is mild reaction to this low-grade infection. So here we can see there is thickening in the periosteum, as well as there is focal or peripheral bone formation. That means periosteum and bone formation due to low-grade infection and the reaction of bone to this low-grade infection. So there is periosteal, thickening of the periosteum, and also there is bone formation. The periosteal sclerosing, similar to endosteal sclerosing in chronic focal and diffuse sclerosing type. We know that the bone is lined from inside with endosteum and from outside by periosteum. So there is thickening. The thickening in the periosteum, similar to the thickening of the endosteum in case of chronic focal and diffuse sclerosing osteomyelitis. The clinical feature of Garre's osteomyelitis affecting children and young adults, most common in mandible, in the premolar molar area, jaw pain or toothache. So since the condition is associated with low-grade infection, that means with carious tooth or any infection or any dental infection, periapical, periodontal, or even pericoronal, so there is jaw pain or toothache. The pain arises from the tooth. Hard bone swelling because there is bone formation and periosteal thickening, so there is hard bone swelling which may last for weeks. The cause could be dental infection, as I mentioned before, soft tissue infection, or cellulitis. So persistent of the infection, this will lead to reaction of bone by bone formation, or even there is thickening of the periosteum. The radiographical appearance, we can see there is here, it looks like onion peel appearance. This is the onion peel appearance. Intraoral periapical view shows carious tooth opposite to bony hard tissue. So here we can see the lower six, first molar, usually there is carious lesion, and here there is the onion peel appearance, or what we call Garre's osteomyelitis. The lesion of Garre's osteomyelitis appears radiographically as onion peel appearance. After tooth extraction, 1 year, we can see that the lesion disappeared. Why? Because after tooth extraction, the cause of the lesion, the cause of Garre's osteomyelitis is usually low-grade infection or low-grade dental infection. That means there is infected tooth Once we remove the cause, the affected tooth, the bone remodel and return to its normal shape. Treatment of Garre's osteomyelitis: tooth extraction or endodontic treatment to remove the cause, to remove the infection, to eliminate the infection. No surgical intervention except biopsy. Biopsy actually in order to distinguish the lesion. What is the nature of the lesion? To diagnose the lesion. After tooth extraction, bone undergoes remodeling and facial symmetry. Facial symmetry, that means returns to its normal shape or normal configuration. A new periosteum may form in certain cases. After removal of the tooth or removal of the cause, there is the bone remodeled and returned to its normal configuration or normal shape, and also new periosteum may form as well. So this is the end of the lecture, and thank you for your attention.